always speaking Chinese. This is the first time I use a lot of English. So allow me to speak the broken English to you. Just very hard to do in the PowerPoint. I hope you can understand it. Okay,
Yes.
Okay?
Very good.
Yeah. Sorry about that. Ladies and gentlemen, about a year ago, my student, Virginia, once shared with me how she used PTNS in the hospital to help patients treat overactive bladder. I suggest that she could try different techniques for applying PTNS. Later, she told me that the results were positive and that the patients felt much better. So, when Sheena invited me to share with all of you, I was more than happy to accept because I hope that through my understanding of bioelectrical meridian therapy, I can help you explore different ways to maximize the benefit of PTNS, ultimately improving the quality of life for patients. Is understanding?
Yes.
Thank you. I will be sharing the English translation just from ChatGPT with everyone, and I hope it is clear. If there are any parts that are unclear during the Q&A section later, Mrs. Carrier Shaw will assist with the translation. Thank you. Sheena just introduced bioelectrical meridian rehabilitation therapy as a part of preventive self-care medicine. In traditional Chinese medicine, the concept of treating disease before it arises and treating disease before it arises, we have three meanings. One, treating disease before it arises. One, maintaining the body's energy, balance, and health means no sub-health symptoms. Two, addressing the early symptoms of illness. Three, preventing the spread of disease from an affected system to other systems in the body. For example, in the third point, when the liver and gallbladder are severely affected, it can cause problems in the spleen and stomach. When the spleen and stomach are severely affected, it can cause problems in the kidneys and bladder. As you can see before, the PTNS show the kidney and bladder have the very, very close relationship. You can see the picture. The relationship between an affected organ and the spread to other organs. One more example. Okay. One more example. When the lung and large intestine are severely affected, it can cause problem in the liver and gallbladder. This the cause problem relationship. You can see lungs and large intestine will cause the liver, and the liver, gallbladder will cause the spleen and stomach. Now I will explain the connection between meridian theory and overactive bladder in a simple way. In meridian theory, common methods for managing overactive bladder include acupuncture, herbal prescription, and bioelectric meridian therapy. Although my main focus is on bioelectric meridian therapy, today I will be sharing how acupuncture is used according to meridian theory. After watching the video provided by the conference about using PTNS to treat overactive bladder, I also found that some hospitals in Taiwan use this device as well. I know that it involves inserting a 5 acupuncture needle called a whole jump. That means like the hair very thin, called the whole jump, just about the ankle and applying electrical current. Today, I will give a brief explanation on how to insert the needle and some application technique based on PTNS guideline. I believe this will enhance your needle insertion experience. Some basic needling technique include 1. Insertion, 2. Lifting and thrusting, 3. Threading. Maybe my pronunciation is not correct. Is understanding?
Yeah.
1. Insertion. The general angles for needle insertion are as follows. 1.1, 15 degrees, suitable for shallow muscle area or when performing penetrating acupuncture. 1.2, 45 degrees, suitable for the edge of bone and points where deep needling is not advisable. 1.3, 90 degrees, suitable for most acupoint on the body. I know the PTNS normally use the 90 degree. Later I will show you how to use the 15 or 45 degree, okay? You can see the picture. Generally insert acupuncture needle, degree and depth. 90, 45, 15 degree. For example, 45 degree from tail to tip. If 45 degree is up to 30 millimeter, the height is about 22 millimeter to inside the body. Needle depth. The general needle insertion depth range from 10 to 15 millimeter. The specific depth for each acupoint is detailed in the acupoint theory of meridians theory. B. Needle direction. Generally, the needle tip is directed towards the affected area. For example, overactive bladder is a condition located in the bladder, so the acupuncture needles should be directed towards the bladder area. Later, I will show you how to feel it. Technique. Generally, the lifting and inserting or twisting technique are commonly used. When using the technique, you need to have a needle sensation on your hands so that the effect will be more significant. Someone, when you use PTNS, any needle sensation in your hand? I need to believe that? Okay, that's good. Later, show me.
You showed me.
Lifting and thrusting. This technique involves lifting the needle from the insertion point and then thrusting it back in. This action strengthens the stimulation of the acupoint to achieve the qi, means needle feeling sensation. Chinese call it is the qi. That one. Threading. It is often used on acupuncture points on the limbs, which will produce a better effect on the acupuncture sensation. There should be a needle sensation during acupuncture. This phenomenon includes sensations such as heaviness, pressure, downward suction, contraction, horizontal oscillation, or rotation of the needle. This feeling is similar to the rise and fall of fish beating a hook and includes a sense of energy transmission along the meridians. We call it the qi needle sensation phenomenon. At this time, the patient may experience of swelling, numbness, soreness, heaviness, warm or coolness at the needling site. There is no needling feeling phenomenon. When using the same needling technique, if the hand feels empty, stagnant, or encounters a hard obstruction, a tingling sound, the needle body jumps up and down, and it feels like the depth of an empty hole. This indicates that the needle has not reached the correct point. General use of acupuncture needle. Normally, we use 70 millimeter, 60, 50, and 40 millimeter. Of course, sometimes, depends on the symptom, we need longer than 70 millimeter. Yeah. PTNS needle insertion location and meridians vary position. PTNS recommends inserting the needle about 3 fingers with approximately 50 millimeter about the inner angle. However, meridians theory suggests using an acupoint called Sanyin Jiao, located 4 finger with 3 chin, about 70 millimeter about the inner angle. This point is where the spine, liver, and kidney meridians intersect in the foot. Later I will show you. The Sanyin Jiao point is commonly used to treat digestive and urogenital system disorders. If this point is tender or painful, women may experience issue-like painful periods or irregular menstruation, while men may face sexual dysfunction and enlarged prostate or digestive problem. For treating overactive bladder, combining Sanyin Jiao with other points like 膀胱俞、圆骨、胎息、中珠、翳门, and 阴陵泉 can enhance the effectiveness of the treatment. Sanyin Jiao position. The Sanyin Jiao point is located behind the tibia and in front of the tendon. Locate 4 finger with 3 chin, about 70 millimeter, about the inner ankle. Chin, that means one of the methods for locating acupoint called bone measurement unit, also known as the finger chin measurement method. This method uses the width of the patient's finger to measure distance on the body for locating acupoint. Understand?
Yeah.
Thank you. Okay, for the middle finger, we call it 1 chin, 1 chin. For the thumb finger, we call it 1 chin. For 2 finger, we call it 1.5 chin. For 3 finger, we call it 2 chin. 4 finger, we call it 3 chin. So we just use that one of the method for find the acupoint. Remember, use the width of the patient's finger, not your finger, because some is very bad, some is very small. Not use your finger, okay? Use the patient's finger to check the distance. Sanyin Jiao point behind the tibia. Yeah. Okay. Here, 3 meridians intersect. Liver, spine, and kidney, the intersection. Okay, so that's very important. Sanyin Jiao location and anatomical relationship. Muscles located between the posterior edge of the tibia and the psoas muscle, with the deeper layer containing the fascia digitorum longus muscle. Nerve. The sharpness nerve, which is on the inner side of the lower leg, and the tibial nerve, which is deeper and at the back end. blood vessel. The gray sharpness when is superficial with the posterior tibial artery and when deeper. And needle insertion. Insert at a 45-degree angle to a depth of about 25 to 32 millimeter. Bioelectric meridian rehabilitation therapy, acupuncture point for treating overactive bladder. Total we choose 15 acupoint for the whole treatment. On the back side, we have choose 5 points for treating the overactive bladder. The first one is called kidney yu, second is called bladder yu, and qi niao and bai wan, ju ben, 5 on the back. The kidney is S2. Treating overactive bladder on the limbs, we choose 10 points. The first one, 足三里、阴骨、阴陵泉、声音胶 before I told you 声音胶 in here, 浮瘤、太溪、圆骨、中珠 on the hand, 一门 on the hand, and now the back leg 围中 choose 10 points. Any question? Let's pause. The introduction here for now. If you have any question, feel free to ask. You can ask now or during the practical session later. The event organizers have kindly allowed me to offer you some experience with bioelectrical meridian therapy, we call BMT. This experience will be divided into 3 parts. Is it? Okay. Any question? If any question you can ask, I have translation. If no, later, okay, you can ask, okay? Now, I will 5 free volunteers will express a health observation through hand diagnosis